You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum, and this is Back at It with Dr. Decompression. Okay, we're back with Dr. Cam. Clinical stuff today.
Yeah, more clinical stuff. Let's do it.
Clinical. I went first last time. I'll have you go first. We chatted a little bit before about the we did low back last time. We're going to do neck. Jump into it.
Yeah, so I had a recent case come in probably about 2 weeks ago, referred by another chiropractor. This particular patient, she's a 34-year-old female. She had already tried chiropractic. She tried PT. She tried acupuncture. They even did injections, medication. And she's got this particular type of pain that goes into her hand and actually all the way up from her neck down and through her shoulder. Okay. And she gets numbness and tingling in her hand that resembles carpal tunnel.
Okay.
And one of the doctors actually told her that she likely had carpal tunnel, which, yeah, exactly. Anyways, she moves along through care and she gets to the PT, and the PT actually recommends that she see an orthopedic surgeon and get an MRI.
Of what?
So, of her neck.
Okay.
So the
Love that.
PT is actually the one that recommended her neck get checked out, get an MRI of it.
Good
And
work.
sure enough, they find a desiccated disc or degenerative disc and a disc herniation at C5, C6.
Uh-huh.
And it's pushing right into that space, actually into the cord space in the right and where that nerve sprouts out
Okay.
at C6. Okay. So she goes and see the chiropractor. She tries all these other things to try to help because the one surgeon's telling her, yes, you need surgery. The other one, so she gets a second opinion.
Wow.
The other one says, hey, you probably don't need surgery. Like you might be able to recover without needing to go down a
Amazing.
super invasive route. So I was like, that's interesting. I don't hear that all the time.
Don't hear
Surgeons typically they are taught to be conservative, but that being said, I felt like one of them was being a little cavalier. Anyways, she gets referred over to me. She's got these sensations going down in her arm. She's actually stopped working. She quit her job so that she could take time to figure out a way to heal this.
Wow. What did she do for work?
So she used to work at a desk a lot,
Okay.
and she suspects that that's potentially what got her to this point to a degree. But she has a heavy history of figure skating, so she's definitely whipped her head around a few times and whatnot. Yeah, so a combination of that slouch posture, being here all day, the neck, the head leaning forward, all of that strain through there in her discs, and then combining that with whipping motions when let's say you have a fall during figure skating and whatnot. So I suspect that's why we ended up here.
Yeah.
Basically. Okay. So she gets to me, we check it out. She's not, or like her physicians aren't fully sold that this is coming from C5, C6 or that nerve root, that herniation that happened there. I get to her and we do an exam, and sure enough, we do some compression tests, some actually distraction tests on here, and this thing improves as we create some decompression in the area actually.
Lift
So
up.
super interesting. What's that?
Walk everyone through, I mean, the compression test, but like, what does that mean? What's it doing?
So one of the orthopedic tests that we do, right?
Yeah.
We'll push on the head in different positions. And there were certain positions that we did that would recreate her symptom. They would travel down her arm into her hand and give her that numbness and tingling, but also shooting pain.
And it won't do that if it's carpal tunnel.
It won't do that if it's carpal tunnel.
Won't do that.
It'll never do that if it's carpal tunnel.
Yeah.
Now, then we did distraction tests. So we actually traction the neck up and created space for that disc, pulling it off the nerve, and then her symptoms reduced. So that was a really good sign. That was super cool. And for the patient, that's like a big deal. They're like, oh yeah, that's definitely coming from my neck, So inevitably we went towards spinal decompression with her. We had to get a pretty decent amount of flexion in the table for this one because she responded best to that angle.
During the testing when you're doing flat.
Yeah, that would give her the most relief for that nerve. So we would set her up a little more flexed, and then we also combined that with electrical stim. So we did direct current, that ARP wave therapy,
Yeah.
and that would also, like, it just completely blocked the pain out. So
Where
she
do you
would be
put,
at
are you
like,
put that on the nerve pain? Sorry, are you put it here or
so
you
I
put
would
it here?
we wrap the leads around the wrist,
Okay.
and then we put the other lead on the neck so that it will hit that whole nerve
Got it.
branch. And even by the end of that, she had like a 50% reduction in pain just from doing the stim.
That's
So we knew we
crazy.
were on the right spot. So we just needed to target it with the right therapies. And it's pretty cool. So we've only been doing this for about 3 visits, and she had multiple days in a row where she didn't have pain. And she's been dealing with this for over a year and a half, or close to a year and a half, where she's basically consistently had pain every day.
Wow.
And it's been up to like an 8 to 9 out of 10.
That's
Like, she
amazing.
had to stop doing everything. She put her life on pause because of this thing. So it was pretty cool to watch her progress so fast. And then I love, working with these cases that I get referred from over by other physicians. I want to make sure I do right by them. So yeah, super psyched about this
That's
case.
a cool I have a few questions on that.
Yeah.
I'm actually curious, and I'm wondering if the audience is curious. After she got diagnosed with the disc bulge, did she see or she went to the other chiropractor first?
She went to the other chiropractor first, and
What
he's
they
actually
do?
helping her because she does have a reverse curve.
Okay.
So her neck is, normally we're supposed to have that C-shaped curve, right? Hers is actually starting to go the other way. Her neck, because of the way it's positioned in her posture, her shoulders are rounded, her head has to go forward, and then this thing is starting to curve the other way. And that's a huge issue, as you know. It's like you can't have that. The structures need to be in alignment to make it so that they don't take a lot of wear and tear.
Yeah.
And then you end up with things like disc herniations and disc bulges. So he's working on her alignment in that upper cervical region specifically,
Okay.
and that doesn't interfere with anything that we're doing. So it
You can
works
work
out
together.
perfect. We can work together. Exactly.
Wow.
In fact, she stopped PT, and I'm actually going to have her start going back in because this is already starting to calm down so much. Because when she was doing PT, it would actually, sometimes it would help, sometimes it would get a little flared up. Same thing with massage. She would get these massages and then she'd be flared up for a couple days, but she might get some relief afterwards, but it would be temporary.
Just not the right timing of those therapies.
Yeah. Yeah. So I think now that we've created some space in there, we should be able to get her jump started back into PT, no problem. And then just get this sucker to fully recover, I think.
And
Yeah.
how big was the disc bulge?
Uh, Unfortunately, in this MRI, they
Hmm.
didn't label the size. It was, some imaging centers, they don't really care as much. They just put mild, moderate, or severe.
Yeah.
This particular one was enough to push into the cord, though.
So it was on the fecal sac? Yeah.
Yeah, it actually pushed into there was actually some contact to the cord.
Wow.
Yeah, so not just defacing the thecal sac, but actually pushing
Dang.
into the core. Yeah. And on top of that, this whole thing, it doesn't necessarily just happen from that C5, C6. I think that she also has a potential entrapment at Erb's point. And we learned this way back in school.
Long
It's
time
a
ago.
spot that sits right behind these muscles, and there's multiple nerves that come up because she'll get referring pains that shoot up into her neck
Okay.
and down into her mid back, like in that spot next to her shoulder blade.
Yes.
You get people talking about that when they get that. I'm feeling it here. I'm feeling it down here. I'm feeling it traveling into my arm. Usually, you want to start thinking Erb's point because those nerves all branch out from under that spot. So when those muscles get tight or things get inflamed or things are just irritated in that point and a little bit entrapped, it's going to give you that more complex looking picture of
Was
multiple
this patient
irritated
having
nerves.
that referral scapular pain?
What's that?
Was this patient having that referral pain, or is this another patient?
She had all three. It would go up in the head, it would go down into the mid, like just next to the scapula, and then it would go down the arm. So yeah, that triad
Wow.
is a real key thing. So we decompressed this area, but we also did some soft tissue work through here. We did some laser, a lot of
Open it
things
up.
to try to help calm down those muscles, the inflammation in the area. And then, like I said, we're seeing big changes. It was pretty cool.
That's really quick too.
3 visits, man.
Yeah.
Kind of wild.
That's
Yeah,
crazy.
she's stoked. We're really happy. Yeah.
Good story.
Yeah, so not all carpal tunnel is carpal tunnel. Keep an eye out for that.
So be mindful if your thumb and your index finger are numb or in pain and you're diagnosed with carpal tunnel, ask further questions.
Yeah, yeah. Are you feeling neck pain with it? Are you feeling anything that's traveling from there? Maybe you should just get this imaged as well to rule it in or out. Have somebody actually look into those, run through the proper tests.
At least have someone look at it before you have surgery.
Yeah, because you and I, we've probably seen dozens of patients that come in and they've got carpal tunnel surgery and it was coming from their neck.
And then it comes back or it never was relieved.
Exactly.
I
Yeah.
wonder what this, we should look this up. I wonder, we got to have one of those guys like, hey, check out this stat while we're, while we're
Yeah.
talking.
Like on
I
Rogan.
wonder what the stat is for failed carpal tunnel surgeries.
Hmm.
Hey, Joe, can you look up the stat of, we'll get there. We'll get there.
But I hear you've been having some cases of those popping in your door recently too. So tell me a little bit about yours.
Crazy. I got a crazy story, but yeah, I'm seeing so many more of those cases that are bad head posture, sitting all day or something positional with work, scapular pain, numbness, tingling, weakness into these kind of 2 or 3 fingers
Yeah.
every week. It's like an avalanche. I don't know what's happened the last 6 months with people. Maybe it's phones, maybe it's stress, but something's happening.
Yeah.
The specific case, woman in her 30s. She was referred by her father-in-law who comes in here who does decompression, does very well. She called kind of an emergency situation. Nothing happened, no trauma, which is common for us, and needed to get seen. She comes in, she walks in like this
Okay.
with her hand up.
Okay.
Okay.
That's the only yeah.
This is the only position. I'm like, if you're listening, you can't see. I'm raising my hand like I'm in class. It's the only position that would give her relief.
Yeah, that's not good.
Okay. So exam, I don't know how much of an exam. We're just doing compression. Same thing, right? We're pushing down. Does that squeeze the area where the nerves come out? And it lit her whole arm up, even more than it was.
Hmm.
So get the MRI, 3 disc extrusions, C4, C5, C5, C6, C6, C7. Like, okay,
Three.
that makes sense. 2 of them are on the thecal sac.
Damn.
There's a lot
That's
of
a
disc
mess.
in that area. So then from a
That's a mess.
targeting perspective, like, okay, I want to target 15 degrees for C5, C6. That's the pattern of the pain. But as you and I have talked, is that going to be the most comfortable position for the patient on the table to get started with?
Right.
Right. So bringing her into full flexion at like 18 degrees was symptomatically more beneficial than doing 15 degrees.
Okay. Yeah.
So I started that after a few sessions of a gentle pull. She comes in after 2 visits. I was talking to Jen on our team. I was like, Jen, wait, her arm's not in the air. Wasn't her arm in the air a few days ago? Like, that's a good sign, that she can
Uh-huh.
walk
I'll
and
take
move
that as
without
a
having
good
her arm
sign.
like this. And
For
then
sure.
eventually, after 2 weeks, she's seen some improvement. The hand pain, it's not retracing yet, but it's less. So the pattern's the same, but it's less intensity. So it's 50% reduced. So we're on the right track. And then I lowered her down to 15 degrees to accelerate that. And after 6 weeks, she's back at work, fully recovered.
That's amazing. That's
Really cool.
wild.
And
That's a crazy story.
just, I don't get this very often.
No,
Shockingly
I can't
often,
say I've
you
seen that
know,
in years, man.
usually like for
Somebody
lower
like
back, but
having a yeah, dude, that's wild. 3 extrusions. That
3
is
extrusions, 2 on the fecal sac. So
a
then
lot.
from a clinical, you're like, hey, do I target the one that's causing the pain, or do I have to maneuver the table and flex it or flatten it based on what's giving them the most relief and not flaring them up?
Yeah, no, I love that approach. I mean, we try to follow the same system. It's low and slow and whatever's most comfortable to start with.
Yeah. I always tell
That's
patients we're not cooking a New York strip. We're cooking a pork butt. We're doing carnitas. We're going low and slow and
slow cook
low and slow.
that. Carnitas, I like that. Pork
No.
butt, man, I haven't heard that one.
And the thing about her, just lastly, is it was from her job. So she's in cosmetics. She does hair and does eyebrows. So
Sure.
she's like this unilateral all day. So hair,
I
makeup, dentists, anything
They
like
are
this.
a mess. Yeah,
Crazy.
those particular professions where they have to lean forward,
Mm-hmm.
their necks are the worst I've seen. They build up arthritis so fast. They build up all these disc extrusions, degenerative disc. It's in my opinion, they're out of all the professions, those particular ones need like the most consistent, like
Yeah.
prophylactic care. You know what I mean? Like if I was in that position, I'd be getting work done every week
You have
just
to.
to undo what's happening
You're
at work.
stressed that you're doing 8, 10
Yeah,
hours, and then you
people have
take a
no
break.
idea until they get to the point where they can't hold like a blow dryer anymore, or they're having trouble even holding a glass.
Or they're walking like this.
Like, or they're walking in like this now.
But also the glass, talk about that. So like hand weakness, grabbing a coffee mug, holding a piece of paper, a shopping bag, something like that becomes troublesome.
Yeah, no, I didn't even mention that the girl that I had for sure, like it wasn't just due to pain that she had weakness, she just had weakness. Like, and she's right-handed, so it didn't make any sense, right? Unless there was an actual nerve injury of some sort.
Yeah.
So, yeah.
So there you go, everyone. Any last
Cool.
comments, Doc?
Uh, like I said, if you're somebody that already you know that you're at a job that you have to lean your head forward, or you are very aware that your posture is already like this, you need to get work done. You need to go be prophylactic about that stuff. You need to be on top of it. You need soft tissue work. You need decompression. You need alignment work. Like stay on top of it so you don't end up that person that can't work anymore and can't be physically active. So
100%. And if you,
yeah.
any type of line of work that someone that's had a back injury, we hear that a lot where they've had a back injury, they felt great, and then all of a sudden nothing happened, they have pain because something's happened before, or they need to take a proactive approach, like you said.
Yeah. Don't let these things snowball because they will.
Yeah,
They're gonna let you know, like your neck and your arm is gonna let you know in 5, 10 years, whatever it is.
it'll come
So
back.
it's inevitable. It's going to happen. It's just a matter of when, not if.
Yeah. Right on,
Yep.
Doc.
All right, man.
Okay.
Good session.
Hey, thanks for clinical session. We will be back again.
Sounds good. Catch you later.
Thanks, Dr. Kim. Bye. Thank you to Dr. Jahangiri. And hey, thanks to our sponsors, Pillowise USA and Power Plate USA for bringing this episode. If you don't, make sure you subscribe to our podcast and our YouTube channel, Back at It with Dr. Decompression. If you have any questions or want us to talk about next topics, email me at info@drjdudum.com, or you can subscribe and then get us through our YouTube channel. Thanks for watching. We'll catch you next time.